Okay, hi, I'm Madison Marshall. I'm going to be doing a pelvimetry demonstration for my Biology 1050 course. The importance of pelvimetry is it's another tool that we have in our midwifery toolbox to assess the pelvis, to know if the pelvis is adequate for normal vaginal delivery. However, another thing that we should inform our clients of is that the size and shape of your pelvis is not the only thing to consider when deciding if your pelvis is adequate for vaginal delivery. You have to keep in mind that the hormone relaxin is released in labor and throughout your pregnancy to soften your symphysis pubis and your coccyx to allow mobility in the pelvis. So here we go. First thing I'm going to do is I'm going to let my client know that I'm going to apply some pressure on her external opening right here with my fist, and I'm going to feel for the tuberosities, which are these parts right here. And I'm going to see if they are landing outside of my fist or if they are inside of the outer two knuckles of my fist. And that can tell me if the pelvis is gynecoid or android or anthropoid or platypoid by measuring this subpubic arc. Then I'm going to insert my 2 fingers into the vagina and place my thumb on the outside of the perineum. Sorry, I have to flip. On the outside of the perineum, and my inner 2 fingers on the inside to palpate the transverse perineal muscles to assess the density and elasticity of the perineal muscle. And then I'm going to turn my hand, drop my wrist, and try to feel for the sacral promontory. In a gynecoid and anthropoid pelvises, I probably won't be able to reach this because they are too wide this way. But in anthroid pelvises, I should be able to reach it sometimes. And platypoid, I will most definitely be able to reach it, and even sometimes with my index finger. If I can't feel the sacral promontory, it's a good indicator that the pelvis is adequate for vaginal delivery. I'm going to protonate my hand 90 degrees to palpate the sacrum from front to back and side to side to assess the shape. It should feel concave or hollow, and sometimes it will feel flat. Then I'm going to hold the tip of my middle finger on the sacral promontory, if I can reach it, to measure in centimeters how much space from the pubic arch to the sacral promontory, to measure the diagonal conjugate of the pelvis. And it's also good to know your measurements of your own hand so you can have a good idea without having to pull your hand out and measure it right there on the spot. And then I'm going to slightly remove my fingers from the vagina to palpate the ischial spines, which are on the sides here. You can see them right here. These kind of sharp looking things. I'm going to palpate these to assess if they are blunt or if they are prominent. And that can tell me a little bit about what kind of pelvis we have. Then I can assess the transverse plane, if it's normal, wide, or narrow, by palpating the ischial spine's diameter. And I'm going to do this by spreading my 2 fingers wide enough so that they're touching them at the same time. If I can't touch them at the same time, it's another indicator that the pelvis is adequate for vaginal delivery. Then I'm going to assess the sidewalls here. I'm going to palpate the ischial spine with my index finger internally, and then the tuberosity with my thumb externally. And if the tuberosity is lateral to the spine, we would call that divergent. If it's parallel to the spine, or in line with the spine, we call that parallel. And if the tuberosity is medial to the spine, we call that convergent. This next part I'm going to do only if the baby is not engaged yet, if the baby's head is not engaged. I'm going to trace the pelvic brim to assess if the brim is angulated or if it's rounded. It should be rounded. And then I'm going to go back down and assess the mobility of the coccyx. In pregnancy, like we said before, the coccyx will most likely be mobile. Then I'm going to palpate the sacral sciatic notch to measure the distance of the arch. I'm going to do that by separating my 2 fingers and noting the distance between my 2 fingers to measure the arc. Okay. Then finally, last thing is I will palpate the subpubic angle internally to get a better idea of the angle of the subpubic arc. In gynecoid pelvises, they're usually 85 to 90 degrees. In android pelvises, it's usually around 70 degrees. Anthropoid is about the same, it's pretty narrow. And then in platypoid, it's very wide, usually greater than 90 degrees. And this would be a good example of a gynecoid pelvis. So this is very wide here. I wouldn't be able to reach the sacral promontory, and also the subpubic arc is outside of my knuckles. Thank you.